I'm Andy Reid. I'm an STI tester with Hudson Valley Community Services. I'm your host for HVCS's 2020 commemoration of International Overdose Awareness Day. I'll be your guide during the next hour of our pre-recorded videos honouring those we have lost to overdose. We will also cover ways that you can prevent future overdose deaths. Here at Hudson Valley Community Services, we believe in empowering people with knowledge and facts so that they can make informed choices about their healthcare and, if they choose, to reduce the potential harm of opioids and other substance uses. We are also here to help without judgment anyone who wants to take an active role in making their health and life better. International Overdose Awareness Day is a global event aimed at raising awareness that overdose deaths are preventable. It is also a day to address stigma associated with drug-related deaths and promote actionable prevention strategies. We want to start with a minute of silence to honour those we have lost to overdose. If you would like to share the names or name of loved ones that you have lost, or those of you who are thinking about today, you can write them in the comments section here on the Facebook Live event. This video will be available afterwards so that you can re-watch or share it with someone who couldn't join us today. Again, we invite you to write the names of those you have lost to overdose or share any message with the group by using the comments section below. We also want to thank our sponsor, PCSB, for their financial support for today's event and for all that they do for Hudson Valley Community Services programs. You'll see their logo throughout the broadcast. Now we will light a virtual candle for a minute of reflective and meaningful silence. Thank you for taking a few moments to remember those lost to and affected by overdose. Next, we will hear from several speakers who have been affected by substance use and or overdose. They each have a heartfelt and touching story to share. After our panel, we will hear from several community service providers, and then you're invited to watch a virtual Narcan training. Frank Barone is the coordinator for Hudson Valley Community Services Syringe Exchange Programme and has been working at the agency for the past 3 years. Frank has a number of years' experience working in the field with people who use drugs, navigating them through services to provide ongoing support to our priority population. His dedication and commitment to the organisation is unquestionable as he continues to grow professionally. Frank's personal experience is an invaluable asset to our programme and clients.
Hi, how you doing? This is Frank from Hudson Valley Community Services. I just wanted to make a quick video for International Overdose Awareness Day and speak about a few things that have been on my mind. Well, the first thing that's obviously been on my mind leading up to Overdose Awareness Day is the harm reduction techniques that we teach to our clients and teach to whoever's interested in order to make drug use safer. So there's a few harm reduction techniques that you can use, which are having naloxone, which is Narcan, and also letting people know that you have that on your person, so that way if something happens, somebody can use your Narcan on you. Also, you can use fentanyl testing strips where clients can test their drugs for the presence of fentanyl. There's also use with a friend, use with somebody to make sure you're not alone. If you use in a bathroom, make sure the door isn't locked. Using less of the substance to see how strong it is. As you can see, there's a lot of different techniques that you can implement to make the opiate use or even just drug use safer in general, because we live and we do harm reduction techniques. We use harm reduction techniques every day, such as putting on our seatbelt or a street light. That's harm reduction. A stop sign, that's harm reduction. So we can look at it as simple as stuff like that, but we can look at it also for using it for overdoses as well. So there's a lot of different things that you can utilize, and there's more about this information if you go to HudsonValleyCS.org. My phone number is on there for the syringe exchange program. Anybody can call and come to the van or anything like that, and we can have a conversation and talk about this stuff and make things safer. The second thing that I wanted to speak about was I've heard my whole life, I've heard a lot like, and I myself am guilty too of this. If the counselor doesn't have lived experience, if the counselor's never used heroin or so forth, their view is worthless to me, which I've changed my mind on. And I I think of it like this, and I look at it like this. There are a lot of doctors in this world, well, most doctors in this world that have never had cancer, HIV, other ailments, other different sicknesses and diseases and viruses and so forth. And these doctors have never had these things before, but they play an important role in treating and curing some of these things. And they've never had the ailments. So we look at addiction as a disease. So I think that we should look at it in the same way. And these people that want to work in this field and want to help people that have addiction problems, that have never had addiction problems themselves, I think that we should embrace these people, because working in this field and working with people who use drugs, we need a lot of help in this field. There's this is a big battle, and we need a large team, a large team to combat this epidemic. So I think that we should embrace people that don't have lived experience that want to help, and maybe just we can do extra training. I just don't think that it's realistic to say that every single person that we need to utilize to help has to have lived experience. That's unrealistic. So I just wanted to speak about this a little bit to break the stigma attached to people not having lived experience. These people can still help. Let them help you. Let them help you. Other than that, I think that's all I really have to say. Like I said, I'm willing to have a conversation with anybody in length about harm reduction. And I hope everybody stays safe out there.
Colleen Rios has over 10 plus years experience as an LPN and has 4 years of experience working with people who use substances. Colleen has worked with the Recovery Centre, now Catholic Charities Treatment Services, and New Hope Manor within the Sullivan County area. Colleen is passionate and committed to substance use treatment, as she has multi-generational roots within the Monticello area and is dedicated to helping her community.
Hi, I'm Colleen Rios. I'm a harm reduction specialist / nurse at Hudson Valley Community Services on 20 Crystal Street, Monticello, New York. I'm here to talk about today our program, the Suboxone program, that's been in place for about 3 years now and has increasing need, especially during the pandemic. We have found, Sullivan County, Monticello area especially has been hit hard during the pandemic. The drug use has increased greatly, overdoses. we need to get together as a community and start working together and making arrangements to work together, from, resources to communicating with the clients to higher level of care, for inpatient treatment, and then come back, into our program. Our model is harm reduction, so we don't, we work with the clients. We don't sit there and prosecute them for relapsing. We just try stronger to re-educate and give them, the benefit. You are going to have slips, but to continue to maintain, sobriety, but also for the clients that are actively using, provide safe kits to prevent infection and disease spread. We also have a new pilot program we started doing with Cornerstone Doctors, Behavioral Health, that is so far working. In order to help the clients, you don't just substitute by giving Suboxone. You need to help also with the mental aspect as well as the physical aspect of the client. I've been in this field for 10 plus years. I've had friends and family members, both lost from drug and alcohol abuse. I think a key thing that we need to do right now is come together as a community and try to reach our youth and educate them, and possibly start other programs with other organizations to gather together as one and, split our resources and technology and information to one another to make our community stronger and help conquer this drug abuse that's going on now, especially with the pandemic. Let's start taking a stand. These people's lives matter also. It's somebody's brother, mother, sister. We need to come together as one, as a community, to help stop the overdose and help these people live productive members of our society and sober. So if you know any family member or friend that's in need, stop down in our office, reach out. We're on 20 Crystal Street in Monticello, New York, Hudson Valley Community Service. Thank you.
John Gomez is a psychiatric mental health nurse practitioner with an MBA from the University of Rochester School of Nursing. He has a clinical interest in depression, anxiety, and addiction. Gomez has been a nurse practitioner at Cornerstone Family Healthcare since July 2019.
Hello, my name is John Gomez, and I am the psychiatric nurse practitioner here at Hudson Valley Community Services. I currently see patients within our Health Hub program, which provides folks with access to Suboxone, also known by its generic name, buprenorphine. This form of treatment is known as medication-assisted treatment. It is available for individuals with substance use challenges specific to opioids. This medication treatment can significantly reduce an individual's opioid use. Some of the well-known opioids include morphine, hydrocodone, oxycodone, just to name a few which are prescribed. In addition, there are also street opioids, what we will call illicit or illegal drugs, which include heroin and fentanyl. At the Health Hub, we provide low threshold access within the harm reduction model to this treatment. This model is another option for those who have been through traditional substance use treatment and are looking for another option. Here at our location in Monticello, we see patients in person and virtually. Our staff and environment allows individuals to feel welcomed and not judged by their substance use behavior. We counsel and educate patients on the harms of their drug use and give them the choice to decide what they want their treatment to look like. We are facing an unprecedented time within our country and across the globe. Folks are feeling isolated and hopeless, which in fact can increase their use. Overdose rates are rising to levels we have not seen since the start of the opioid epidemic. We come together today to remember the loved ones we have lost. We also want to encourage those that are still struggling to reach out for our help. Wherever you are in the process of your recovery, and our staff are here to provide support. It is a time to be hopeful. It is a time to remember, and it is a time to act. Help end overdose today.
Marissa is a globally recognized healthcare technology innovation advisor. Advising both public and private clients, Marissa is widely recognized for her cutting-edge competitive strategies. Her innovative thinking and dedication to the opioid crisis has yielded 2 nationally recognized technology solutions which save lives every day.
Hi, everyone. My name is Marissa Barberi, and I am thrilled to be with you today. Thank you to Hudson Valley Community Services for asking me to join you today. My name is Marissa Barberi, and I am the founder and developer of PureRx. My company, Competitive Solutions, developed this product in direct response to a need. In my family, I watched a boy grow up, and I also watched him die of an addiction, suddenly and tragically. And I want to inspire you before I begin to follow your passion. If there's something in this world you want to change, don't wait for it. There's so many people that will help you make that change. And that's what I did with PureRx. After this boy died, I decided to volunteer my time to learn more about the problem of addiction and data-informed help. How could we use systems? I'm a technologist. I've been developing systems all throughout New York and the nation all my life. I graduated with a master's in computer science. I worked in hospitals and healthcare centers all over integrating systems, but I couldn't help save this boy's life. What I did was I started to learn about the challenges that we're having with data in this time. And I sat down with the Data-Informed Opioid Task Force, which was comprised of 7 counties and experts from all those counties with a desire to help. And I learned about what they needed. And through that effort, volunteering my time, because I can't cook, I developed with the National Guard a opioid tracking tool. They had it already. We just improved it. And I thank the National Guard today and Catholic Charities for allowing me to be part of that project. The tracking tool is at St. Luke's Cornwall Hospital. But after I developed that tracking tool, I learned about the function of a peer. And I thought, wow, this is something this boy could have used. Tell me more about peers. For all of you peers out there, I want to thank you from the bottom of my heart for everything that you do, because there's more than clinical, a clinical component that helps with recovery. There's the warm hand of a human, the inspiration, the hope, the love that helps people recover. So I wanted to jump in this pond and get something out there so that no patient that asked for a peer would have to wait for one. I wanted to get one to the bedside, to the courts, to the jails as fast as possible. So we developed PureRx. PureRx acts like Uber. The location clicks a button and says they're looking for a substance use peer, a mental health peer, or a co-occurring peer. And that is broadcast to the area peers. and they get a text and they know immediately. PureRx has been live since 2019 in Orange County, and already we have great outcomes. PureRx can find a peer in less than 10 minutes, and it's increased the referrals from a hospital to more than 225%. Outrageous, right? It goes to show you that the nurses like to use PureRx. Why? Because they just press a button. They don't have to call or play phone tag. They just select what kind of peer they need, and they get that peer. It's now in the Orange County call center. It's in the NEWBURGH drug court, and we have 3 other states registered: Indiana, Kentucky, and Alabama. It was also written up in the CDC's OD2A grant as an innovation by one of our customers. So we're thrilled, absolutely thrilled, and I could not have dreamed about this day when PureRx can be making a difference in people's lives. In less than 10 minutes, I was going to say 2, but let me be realistic. In less than 10 minutes, agencies and calling locations like hospitals and drug courts and all these different other locations can register to use it and start receiving calls. So thank you so much today. I'd love you to visit www.pure-rx.com. And once again, please follow your dreams because you can make a difference in this world.
We hope you found those personal stories inspiring and enlightening. Next up, we will hear a few representatives from local non-profit agencies that provide substance use disorder services and can help those in need of support and advice. And stay tuned for our virtual Narcan training on how to administer a life-saving dose of Narcan to reverse an overdose in progress. Team NEWBURGH is a community-based collaborative consisting of more than 75 partners. Its main aim is to combat issues such as substance use and to promote prevention strategies. Catholic Charities works as the lead agency for this coalition.
Hi, I'm Regina Sislak. I'm the Assistant Director of Prevention Services for Catholic Charities and the coordinator of Team NEWBURGH, which is a substance abuse action team. We have been in the city of NEWBURGH for over 15 years, and we provide prevention services, trainings. We do Narcan trainings. We have provided a drop box in the city of NEWBURGH PD, so if you have any unused prescriptions or expired, you can drop them off right in the lobby of the police department. We also provide lock bags if you need them. We're on the 4th floor at 280 Broadway. My telephone number is 569-0034. My extension is 1825. Again, my name is Regina Sislak, and we also can help you with other services through Catholic Charities. We're all on the 4th floor, immigration and case management. So please come and see us. We can provide alcohol, tobacco, and other drug trainings and trainings for your staff. Just give us a call if you have anything that has to do with prevention and prevention services with substance abuse. We'd be very happy to help you. Thank you.
Eric Dintone is the Associate Director of Regional Services for Arms Acres and Conifer Park. He is a master's level counsellor and has been in the field of substance use treatment for 22 years. Eric has been with Arms Acres and Conifer Park for over 14 years, developing relationships and partnerships with many other organisations in the Mid-Hudson region and previously in New York City. More recently, he has led many projects aimed to improve outcomes with Arms Acres patients as they transition back to the community.
Hey everyone, my name is Eric Dentrone, and I'm a regional coordinator for Arms Acres and Conifer Park. We provide inpatient and outpatient substance use treatment in 2 facilities. Arms Acres is in Carmel, New York, in Putnam County, the Mid-Hudson region, and Conifer Park is in Glenville, New York, in Schenectady County, the capital region. We offer medically supervised detoxification, inpatient short-term rehabilitation, and outpatient opioid treatment programs. We recognize that there are many paths to recovery, and medication-assisted recovery is certainly one of them. All of our programs therefore offer induction onto the full range of options that are available: methadone, buprenorphine, and naltrexone. Our intake office for inpatient is open 7 days a week, and we provide transportation as well. If you know someone who needs inpatient detox or rehab, call 1-888-227-4641. Our outpatient program and opioid treatment program in Carmel has same-day access. You can walk in at any time, Monday to Friday, from 9 a.m. to 3 p.m. and get the help that you need. In many cases, people are able to get onto methadone or buprenorphine that same day. For more information about our outpatient program, call 845-225-5202. Overdose deaths are preventable. Time to remember, time to act.
The Centre for Recovery is committed to helping patients with substance use disorders attain and maintain sobriety in a safe, supportive, and person-centred environment. They are a judgment-free practice that believes healthcare is a right and not a privilege.
My name is Marilyn Morales, Vice President of Addictions at Center for Recovery at 3 Commercial Place in Newburgh. On behalf of Center for Recovery and Cornerstone Family Healthcare, we'd like to thank Hudson Valley Community Services for coordinating this event in honor of International Overdose Awareness Day. Thousands of people die of overdoses in the U.S. each year. They come from all walks of life: neighbors, co-workers, family, and friends. We grieve alongside those that have experienced the pain of a drug-related death. Overdoses are preventable. The Center for Recovery is committed to helping patients with substance use disorders attain and maintain sobriety in a safe, supportive, and patient-centered environment. We are a judgment-free practice that believes that healthcare is a right and not a privilege. The Center for Recovery uses a combination of traditional and non-traditional holistic programs and tools to aid clients in their sobriety. We have a wide range of services, including a chemical dependency outpatient program, an opioid treatment program, and a day treatment program. If you or someone you know is in need of our services, please call us at the Center for Recovery at 845-220-2146 or visit us on our website, www.cfr.care. Thank you and be well.
The mission of Fearless Hudson Valley, Inc., formerly known as Safe Homes of Orange County, is to build an informed, just, and accountable society so all people can experience supportive and safe relationships free from abuse, exploitation, and oppression.
Hi, my name is Renee. I'm a youth educator with Fearless Hudson Valley, formerly known as Safe Homes of Orange County. Fearless Hudson Valley was founded in 1986 over a kitchen table by people who wanted to make a difference. Now we are the only private, not-for-profit agency in Orange County, New York, dedicated to assisting survivors of domestic violence, teen dating violence, and human trafficking by providing free and confidential services to those in Orange and Sullivan counties. Our mission is to build an informed, just, and accountable society so all people can experience safe and supportive relationships free from abuse, exploitation, and oppression. We do this through advocacy, court accompaniment, providing emergency shelter, collaboration with our local police departments through the Risk Reduction Response Program, community and youth education, now with both virtual and in-person workshops, and our crisis hotline. The first step in accessing our services is calling this hotline, but you can also locate Fearless Hudson Valley at 280 Broadway in Newburgh, New York, or at the Sullivan County Government Center in Monticello, New York. Abuse can happen to anyone. That's why you can access services 24 hours a day, 7 days a week, 365 days a year through calling our crisis hotline at 845-562-5340. Again, that's our crisis hotline, 845-562-5340. We're Fearless Hudson Valley, and we're reclaiming our safety.
Thank you to our partners in the community for those messages and for joining us in support of those seeking services. Also, again, thank you to PCSB, our financial sponsor of today's International Overdose Awareness Day event. This year's theme for International Overdose Awareness Day is Overdose Deaths Are Preventable, Time to Remember, Time to Act. Here are video greetings from several HVCS staff sharing that message.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose death is preventable. It's time to remember, and it's time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. It's time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. Time to remember, time to act.
Overdose deaths are preventable. It's a time to remember, it's a time to act. End overdose now.
Those were my amazing colleagues at Hudson Valley Community Services. Thank you for creating those personal videos. And now we present a video of a Narcan training. We usually offer this training in person and hand out Narcan kits to those who attend. But due to the coronavirus pandemic, we switched to holding these trainings by video chat. If you would like to receive a kit, which will include 2 intranasal doses of life-saving Narcan, stay until the end of the video to learn how you can obtain one. And now let me introduce Jackie Perez and Cameron Coleman from our Education and Prevention Department for our virtual Narcan training.
Hello, my name is Jackie Perez. I will be co-facilitating this training with Cameron Coleman. Today, as we raise awareness and reduce the stigma of drug-related deaths, Today, we also want to acknowledge the importance of providing easier access to Narcan trainings, education, and easier accessibility of Narcan kits. COVID-19 pandemic has caused a surge in drug overdose deaths, and we must remind ourselves that we continue to have an opioid crisis during COVID. Social isolation comes with practical dangers, plus added stresses such as loss of jobs, lack of food, homelessness can contribute to the increase of use of drugs. This is why it is our goal to provide more Narcan training and easier accessibility of Narcan kits in the Hudson Valley region. Would you know where to obtain Narcan kits? Well, I'll explain that today. We at HVCS are a certified Narcan provider, and we provide different methods of training. We provide virtual Narcan training. We do face-to-face, definitely keeping that social distancing guidelines. We also do it over the phone. And we also have the availability of providing Narcan kits at our syringe exchange program van, which covers 5 counties. That is Orange County, Dutchess, Sullivan, Ulster, and Rockland. If you need any kits, if you're in need of Narcan kits, if you are reporting that you've used a kit, if it is expired, if you have a friend, a loved one, family member who needs training, we will be able to provide that. And if necessary, we will also provide the delivery. You can give us a call at 845-476-2190. If at any case we are unable to deliver or provide that Narcan kit for you, during the pandemic, what we've done is we've collaborated with different community Narcan providers, such as Team NEWBURGH, the National Guard, our local health departments, to name a few. And what we've done is, in case that we're unable to provide you with Narcan kits at the time, or vice versa, our other community providers are unable to do that, we maintain contact and we help each other out. So if one person can't do it, then maybe another provider is able to deliver the kits. So we try to eliminate any type of barrier to prevent somebody from getting their Narcan kit. Our goal is to have the entire Hudson Valley with the availability to have a Narcan kit, especially during such an increase in overdoses that we have been experiencing during COVID. Another method of obtaining Narcan would be through NCAP, which is our naloxone copayment assistance program. So in New York State, if you have health insurance, it would cover $40 of your copay. So you could go basically to like a CVS, Walgreens, Rite Aid, Walmart pharmacy, and you would let them know you do not need a script. You would be able to go and obtain your kit, and it would cover $40 of your copay. The next form of obtaining Narcan would be through NextDistro. So if you go to www.nextdistro.org, it's an online mail-based harm reduction platform. So you're able to receive Narcan kits through the mail through them. So now that you are aware how to obtain kits, let me move on to what Narcan is. What is Narcan? So naloxone is a medication that temporarily reverses an opioid overdose. Naloxone is an active ingredient in Narcan. So Narcan is the brand name of the generic drug. Naloxone is available through a nasal spray and an intramuscular injection. I want to emphasize that it only works on opioids, but it is safe to use even if opioids are not present. So if you have a medical condition, the person doesn't know and they administer the Narcan, and let's say it's a heart attack, that will not affect you if they do administer the Narcan. What are opioids? Opioids are hydrocodone, Percocets, fentanyl, heroin, methadone, Tylenol with codeine, OxyContin, morphine, oxymorphone, carfentanil. Also, Narcan does not reverse an overdose that is caused by other drugs such as benzodiazepines, methamphetamines, cocaine, or alcohol. Who is at risk of an overdose? Someone who mixes opioids with either alcohol, pills, or cocaine, that would be a big risk. Tolerance. So if you're exiting the jail or coming out of a hospital, a detox, especially a methadone detox, that could be a huge risk if you want to use and you go back to using what you were, the amount of drugs that you were using at that time. Your tolerance has decreased, so that would be an issue. The quality. If you are you do not know what the quality of drugs is, you're going to a brand new maybe drug supplier. It's important that you test your drugs. Use fentanyl strips if necessary. Another risk is using alone. So behind closed doors, locked doors, where you cannot be found. It's important that you try not to use alone. Leave the door unlocked. Call someone. During a COVID crisis, if we're during a social isolation and we cannot be around people, call somebody, do the FaceTime, stay on the line with the person so the person is aware if they feel like you are having the beginning signs of an overdose. Make sure that Narcan is visible so that they're able to administer Narcan if necessary. Okay, so now I would like to pass it to Cameron, who will continue the next portion of the training. Thank you.
Hi, folks. I'm Cameron Coleman, Education and Prevention Program Supervisor here at Hudson Valley Community Services. Thank you so much to everybody who's attending today and to Jackie for reviewing the first portion of this training. So let's get into it. First thing we'll be reviewing are signs of an overdose. So whether this is someone you know or just someone you stumbled upon, let's review the specific symptoms that you can recognize to determine if the person is overdosing or if something else is going on. Major signs are the person is unconscious, they're not waking up even when you shake them or call their name, slow, restricted breathing that sounds very similar to a snore or a gargling sound, blue, gray, or pale skin color or lip color. Something important to note here is that despite what we've seen in movies, overdoses generally do not happen immediately after using. Overdoses caused by an unexpected dose of fentanyl do frequently result in an immediate overdose. However, in many cases, the overdose can occur up to an hour after using. Depending on the strength of the opiates in the person's body, multiple doses of Narcan may need to be administered. So next, let's get into the steps and how to administer Narcan. So you've identified an overdose and are proceeding with Narcan administration. You've shouted the person's name if you know it. If not their name, just yelling, "Hey, are you okay?" is also fine. Now you see that they're still not waking up after you've shouted to them and tried to shake them awake. We'll move forward with how to use Narcan. So first, we always recommend that 911 is called immediately, as the person may be in need of additional medical assistance when they regain consciousness, or they might not wake up at all from the Narcan, which is why we do encourage folks to seek immediate medical assistance after being revived from an overdose. Make sure when you call to let the dispatcher know that you have a person who's unconscious so that they can get there as fast as possible with EMT services. If other folks are around you, you can point to one specific person and encourage them to call. If not, you can call and put your phone on speaker while proceeding. So now what you'll do is make sure that the person is laying flat on their back. And if this is not possible, then leaned back in a chair can also work if necessary, as long as you're able to tilt their head back. So now that they're laying flat, you can begin to administer the sternum rub, which is when you put your fist together like this, your knuckles out, and then you're going to rub your chest cavity with your knuckles. So the hope here is that the pain will ignite enough adrenaline in the person to wake them up without the use of Narcan. So once doing the sternum rub, if the person is still not awake, you'll move forward with the Narcan dose. So where other forms of naloxone or Narcan in the past have been intramuscular and required some extra assembly, the nasal Narcan is both twice as strong as the previous dose, does not require any assembly. So there's 4 steps to keep in mind when administering Narcan: peel, place, press, and replace. And for the purposes of this training, I'm going to skip the replace piece, as I know Jackie already reviewed the various ways you can obtain Narcan and who to contact to do so. So here's an example of what a typical Narcan kit looks like. And in case you forget how to administer it, these instructions that we're going to go through are also included inside every sealed dose of Narcan. So first, we're peeling off the packaging to remove the seal. Okay. So once you've removed the packaging, peeled, you're going to take it out and holding the Narcan with your thumb on the bottom of the red plunger and 2 fingers on the nozzle. And then while ensuring that the person's chin is up with their head tilted back, similar to a Flonase or any type of nasal spray, you'll place the tip of the nozzle in either nostril until you feel your fingers touch the bottom of the person's nose. And then once it's placed and you've ensured that the head is tilted back, you'll press the bottom of the plunger firmly to release the entire dose into the person's nose. So now we wait to see if the medication works, which can very often feel difficult to do when someone does not instantly wake up. However, although Narcan isn't harmful, it does sometimes take a full 3 to 5 minutes for the medication to work. And this is important to know because as a result of this, if additional doses are used before the first dose has had a chance to fully kick in, we can unintentionally push people further into withdrawal than they need to be, making them feel more sick when they wake up than they would have otherwise. So while waiting the 3 to 5 minutes, you can provide chest compressions or rescue breathing if you feel comfortable doing so. If rescue breathing will encourage you to use the face shield mask provided in your Narcan kit. And the rescue breathing piece has been deemed optional during COVID-19, so only do these steps if you know how and are comfortable doing so. So if 3 minutes have gone by and the person is still non-responsive, you can go ahead and administer the next dose of Narcan. You'll continue rescue breathing until the person responds or EMT arrives. If the person does not respond and you need to leave them for any reason, you'll want to put the person into the recovery position. And this is where you place a person on their side to prevent them from rolling over and potentially choking on vomit. So to get someone in this position, you'll roll them onto their side with their underarm bent to prevent rolling, top arm with the hand under their chin to keep their mouth open, and then their top leg bent over their bottom leg to support their weight and prevent them from rolling over. So now let's talk aftercare. Narcan takes 3 to 5 minutes to kick in and wears off in 30 to 45 minutes. Now, with that being said, once someone is overdosed and woken up, they won't remember or know what happened. And to their understanding, they might be upset that you just woke them up from what they thought was a really good high. So with this in mind, it's really important that you prepare yourself for the person to be disoriented or upset, and just to explain to them, hey, I just used Narcan and woke you up from an overdose. The Narcan only lasts 30 to 45 minutes, at which point you could go right back into an overdose. You'll want to advise the person against using any more opioids, as with the Narcan in their system, they both won't feel the high of the drugs and also are at a very high risk for going right back into an overdose in that time frame. We ask that you stay with the person for at least an hour to an hour and a half, regardless of whether or not they've woken up. However, if you absolutely have to leave, just make sure that you have called 911, and if the person is still unconscious, that they're in the recovery position. So once you've used your Narcan, you can use any of the methods that Jackie had mentioned earlier, including calling the phone number that we wrote on the back of your certificate or certification card if you received your kit from us. So when caring for your Narcan, keep in mind that it's temperature sensitive and is meant to be stored at room temperature, or anywhere from 59 to 77 degrees Fahrenheit. Don't leave Narcan in your car. Your Narcan does have an expiration date that's typically 1 to 2 years, and when possible, if you notice your kit has expired, we'll always encourage folks to replace it ahead of time. But with this in mind, though, all Narcan is good Narcan, and if you witness an overdose and have some expired Narcan accessible, go ahead and ignore the expiration date, use the Narcan. And now lastly, I just want to briefly review the Good Samaritan Law, what it is and who it protects. So in New York State, the Good Samaritan Law was designed to encourage New Yorkers to call 911 if they witness an overdose without fear of arrest or criminal prosecution for possessing small quantities of drugs or alcohol if underage. This law only protects the person who is calling and the person who is overdosed. So keep that in mind for other folks at the scene in the event that 911 is called. So for those two parties, the Good Samaritan Law protects from the possession of controlled substances up to and including an A2 felony offense, so anything under 8 ounces, possession of alcohol where underage drinking is involved, possession of drug paraphernalia. The law does not protect against A1 felony possession of a controlled substance, so 8 ounces or more, sale or intent to sell of controlled substances, open arrest warrants, and violation of probation or parole. So that concludes our Narcan training today. If you've watched this video and live in New York, you can now consider yourself a certified trainer and follow up with the resources that Jackie mentioned earlier to get your kit and your certification card. I know this was a lot of information, and we're so grateful that you took the time to participate in our event in memoriam of International Overdose Awareness Day. If you have any questions about Narcan, this training, or any additional services provided, please don't hesitate to reach out to us. Thank you so much, folks. And remember, overdose deaths are preventable.
Thank you, Jackie and Cam, for conducting that training. I hope you found it informative and useful. Now remember, overdose deaths are preventable, and intervention with a dose of Narcan can be a critical life-saving step. Now that you know how to use Narcan, you can get information on obtaining your Narcan kit with 2 doses by calling us or texting us at the numbers on the screen. You can also email us at Jackie or Cam's email address, which is also on the screen. We will email you a kit, we will mail you a kit, or help you get one from a pharmacy near you. And you can rewatch this video here on our Facebook page if you need to review any information or relearn any of the steps in the process. Thank you again to our sponsor PCSB for their financial support today, and please visit them at www.pcsb.com. My name is Andy Reid, and it's been my pleasure to be your host of the 2020 observance of International Overdose Awareness Day. If you or someone you know are facing an issue with substance use disorder, or if you have a question about Narcan, overdose, or any other issue, please contact us at our phone number or email address on the screen now. And yes, you can even text us. Thank you for watching and for helping us reduce the stigma of overdose deaths. Please take care of yourself and each other. Goodbye.